Assalamu alaikum. Cannot hear you. You're on mute.
Can you hear me? Can you see me?
No, yes. Looking smart, sharp. Both of you. Brother Mitchell, you're still on mute. You're still on mute. Brother Mitchell.
Now I'm unmuted.
You are unmuted now. All right, you're the host now, Brother Mitchell.
Okay, now you're gonna work with me to get the people in the background.
Yes, so I'll stay here, but I'll be as the co-host or whatever, but you are the host.
Okay, let me.
Hiba, after a long time, welcome.
Nice to see you all again.
Nice
Thank
seeing
you.
How are you doing, Hiba?
Good, alhamdulillah. How are you?
Nice to see you. Alhamdulillah.
Brother Mitchell, there are so far 15 attendees. You want to address them?
Yeah, I'm trying to. Why is this? Let me see if that works.
There you go. You want to share that screen again?
It's not. I'm having problems with the share. It goes to out of the meeting, so I'm not. Let me not share. Okay.
Assalamu alaikum, Brother Mitchell.
Walaikum salam.
Wa alaikum salam.
Somehow it's not giving me the panel access.
Okay. Well, right now you're by unmuting you individually, you'll be in a position to speak. Okay.
Do you know when that email was sent out?
That was sent out with the original panelists. You were on the original panelist when I sent out the panelist. You know, let me see if we can just send you a new one. Okay.
To all the guest and attendees, we'll be starting very shortly in a couple minutes.
Assalamu alaikum.
Walaikum salam. All right.
Well, we welcome you all for joining us this evening on this timely webinar to share with you the information we've learned about the vaccination and its intended rollout here in the state of Illinois. We are honored this evening to have as our guest speaker, Dr. Ngozi Ezike, the director of the Illinois Department of Public Health. She will be joining us at 7 p.m. In the interim, this presentation will be led by the chair of the CIOGC Joint COVID-19 Task Force, Dr. Kamal Elderawi, to give us an update on where we're at, not only with respect to the vaccinations, but our current state of the infections rate of the COVID-19, the coronavirus. As preliminary remarks, I'm not able to display them for you at this time, but just as preliminary remarks, this is a webinar intended to provide information only. It's not designed to give you legal or medical advice. We advise you to consult your personal physician or your attorney for any kind of decisions that have either medical or legal implications. This is strictly for information purposes only. The panelists, whatever opinions that they will share with you are the opinions of that particular panelist. And you should, once again, guide your actions in consultation with, while seeking professional advice. So at this time, I would like to turn the floor over. He has displayed his PowerPoint presentation, and that we welcome now Dr. Kamal Elderawi, Chair of the CIOGC Joint COVID-19 Joint Task Force. Dr. Kamal.
السلام عليكم ورحمة الله وبركاته. رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي. جزاكم الله خيرا for joining this webinar. Are you able to see my screen?
Yes, we can see your screen.
You are, okay. Again, thank you so much for joining. We are continuing with our educational effort, with our effort in CIOGC COVID-19 Joint Task Force to educate and guide the community. And we are so excited to have Dr. Ezike with us tonight. I'll just give a brief overview until she joins us. So just a quick disclaimer, this is again still an evolving situation, and we ask people to continue to follow local, state, and federal guidelines. For more information, you can visit the CDC website or the Illinois Department of Public Health, or and the WHO website also has some great information for people internationally. So COVID-19 continues to be a huge burden on people around the globe, with over 2 million deaths so far, close to 95 million cases by now. In the United States, I think we surpassed 400,000 deaths with around 24 million cases. And as you can see, the entire United States are affected. Every state is affected by this COVID-19. As you can see, cases of COVID-19 continue to increase globally and in the United States, as well as deaths. And deaths, as you can see, have been increasing globally as well as in the United States. So the situation is very serious, and as you can see, whether we're talking about cases or hospitalizations or deaths, we have increases around the globe and in many parts of the United States. not only the number of cases has increased, but the likelihood of somebody basically getting infected or has increased in many parts of the world and in the United States. So this slides illustrates basically the incidence, the risk of getting infected. Who is at more risk? As you can see, early in the pandemic, we had older people at increased risk of getting infected. But after June, we are seeing younger age groups being at increased risk of being infected. So it's not only the older folks around us or our families and community members, but now we are seeing increasing rates and increasing risk among younger age groups, namely the 18 to 24 years old, and then the 25 to 44 years old. Even among children, we are seeing the risk going up with schools and activities. I think this pandemic has a great toll on all of us, and people are trying as best as they can to pursue some kind of routine, basically lifestyle, but it's really way far from being routine. So the risk of getting infected, as you can see, is affecting the younger age groups here. So the good news is the case fatality rate, what the case fatality rate means, it is basically the percentage of people who die from the disease after getting it. So among those who get the disease, what percentage die from the disease? The good news with the new therapeutics, with the new measures countries are implementing, we are seeing more likelihood of survival, which is very, very good news. Now, Illinois continues to be also severely affected by this pandemic, with, as you can see, with old people around the state, counties, and cities and towns are affected. As you can see from this graph, we have over 1 million cases, close to 1.1 million cases identified in the state, with over 18,000 confirmed deaths. The good news is the recovery rate continues to be high, and now we have a vaccine that's being administered. So again, the wave we got hit with in Illinois in the last several months is more severe, more serious than what we got earlier. However, in recent weeks, we are seeing a decline in the number of deaths, which is really promising. So as you can see, the curve went up until the beginning of November. It increased rapidly and exponentially, but now we are seeing some light at the end of the tunnel, which is really good news to celebrate. What this slide shows is basically minorities, vulnerable populations continue to be disproportionately affected by this COVID-19, and they are more likely to die from the disease. Also, deaths and mortality continues to be higher among the older age group. However, we are still seeing children and younger folks who are dying from the disease. Now, there has been news, and we have some cases, and we have some cases in the state, basically with the new variant. There are several variants, but here we have the variant that was detected earlier in the UK. I think it has been detected in parts of the United States and in Illinois as well. So far, what we know about this variant is that it is spreading faster and it is able to infect more people. However, we don't have any evidence to suggest that the variant causes a more severe or fatal disease. However, it's spreading faster, and it is and it's infecting more people. And we have some news that the vaccines that have been developed are expected to work with the new variant as well. So that is good news. But the not so good news is it's spreading faster, and it is more likely to infect people. So basically, people who are exposed to this virus are more likely to get the disease. Now, what we are recommending now, even with the new vaccine basically around us, and some of us have already taken it, we're still recommending, people to continue to take measures to protect themselves and their families and their communities. And we're going back to the basics, to washing hands frequently and thoroughly, covering your mouth and nose with a mask when you're in public, at home, with your sleeves, with your elbow. If you are in your household, you want to avoid touching your eyes and nose and mouth and touching spaces as well. You want to keep the physical distance of 6 feet from other people outside of your home. Stay out of crowded places and large gatherings. Clean and disinfect frequently. Touch objects and services. And we definitely recommend that people who have symptoms, people who tested positive or have been around others who tested positive, to stay at home and seek medical advice. So even with some of us taking the vaccine, we are still recommending people to continue to take these measures. And we are talking about all of these measures, not one, not two. And the more layers of protection we have, the more activities we engage in to protect ourselves and our families and people around us, the more protection we get. So as you can see, these different measures serve as layers of protection, and you want to use all of them, not just put a mask. So if you have a mask on, that does not mean you can really join crowds without having to worry. So still staying outside among large crowds for a longer period of time might expose you to the virus as well. So you want to take all of these measures together to protect yourself and others around you. We want to make sure we follow the guidelines for properly wearing the mask. You want to wash your hands before and after touching the mask. You're wearing the mask and touching it, and then touching other surfaces and going home without washing your hands. It's in a way you are bringing all of these germs you have accumulated and basically spreading them. We don't want that. So you want to wash your hands before and after. You want to touch only the bands or ties when putting on or taking off your mask. You want to make sure both your nose and mouth are covered, not just the mouth and leaving the tip of the nose open. We recognize the fact that it's not easy for some people, but we want to try our best and we want to do it the right way. So when you tighten your mask, you still want to make sure you can breathe and talk comfortably through your mask. And you want to wash reusable masks after each use. If the mask is disposable, discard it when visibly soiled or damaged. So we want to make sure we're really doing it the right way, so we can ensure the maximum protection. So I just want to share with you some examples of how how the disease could easily spread, and why we need to avoid crowds, why we need to take measures to protect ourselves and others. So basically, this is this slide is to illustrate what happens when you are exposed. So here we have among 55 guests who attended a reception, where one case was positive. So 30 cases of those 55 guests were tested positive to COVID-19. So 30 out of 55 after being exposed to only one person who attended that wedding. So those 30 people, exposed others to it. And a total of 177 cases basically resulted from this reception that was attended by one positive case that spread it to others, including 7 deaths. So even though you might be thinking, I'm strong, I'm less likely to die from it, you might spread the disease to people who have less immunity, who might die from it. So we want to just keep that in mind as we are mingling, as we attend crowds. We definitely discourage people to attend crowds, and we want to make sure everybody practices social or physical distancing. This is another example. I'm looking at the time. This is another example of how an outbreak at an overnight high school retreat. One case, although they tested the child or the child before attending the retreat, a few days later, that child tested positive. But basically 76% of the students and staff who attended that retreat were diagnosed of COVID-19. So I'm just showing you these examples to illustrate why we want to avoid crowds, why we want to practice these measures to protect ourselves and others. So another example here, 44 of 22 players developed COVID-19 after an indoor recreational ice hockey game. So basically it is serious. Even one index case can lead to 177 cases and 7 deaths, as we saw earlier in the earlier slide. So basically, other examples, this slide illustrates the difference between counties in Kansas with a mask mandate and counties without a mask mandate. You can see how rates of the infection are increasing or have increased between June 1st and August 23 in those counties that did not mandate masks. So masks protect people. So what can we do? How can we develop immunity? How can we protect ourselves and others? So basically, there are 2 ways to become immune: either to get infected or to get vaccinated. To get infected and survive, obviously, or to get vaccinated. If you get infected, we don't know who might survive and who might not. So basically, now we're talking about the need for the vaccination. And the goal is to establish what we call herd immunity. What we mean by herd immunity is to surround a case, to surround people who are positive with people who are immune. So to minimize the likelihood that an infected case will come in touch with somebody who is susceptible. And that way you protect the whole community. But we have to establish, we have to have a large percentage of the population immune. We're talking about around 70 to 80% probably for COVID-19. So this is why we need to vaccinate the vast majority of the population. And this is how we ensure the protection of everybody. So the good news now, we have 2 vaccines. We have 2 vaccines approved in the United States. We have an AstraZeneca vaccine approved in some countries, and basically the Pfizer and the Moderna vaccines that have been approved in the United States, both of them have very high efficacy rate. They're very effective in preventing, clinical disease, especially severe disease, So I don't want to spend too much time on the vaccines, but basically what I want to highlight is the fact that, vaccines save lives. We know we vaccinate our children all the time, and we do it because we want to protect them. This is not an exception. There are, some side effects to each vaccine, like any medication we take, but they still protect and save lives. So would the vaccine protect everybody? Obviously, we don't know the answer to that question. We have two vaccines with very high efficacy rates. So basically 95% efficacy rate. So we are hearing reports about deaths here and deaths there, especially among the older population. People die every day. So unless we compare deaths among two groups, have the same age composition, the same age distribution, we cannot really say the vaccine is dangerous because some people who took it died. Some people die every day, and some people take medications and die. So that's we want to make sure we distinguish between myths and facts, and understand and get the information from the right sources. Even with the vaccine, we are asking people to continue to practice measures to protect themselves and others, to continue to practice social distancing, to continue to take all of these measures, to continue to wear their masks. We don't know if people who are vaccinated are able to spread the disease or not. As of now, it is highly likely, because the vaccine so far has been proven to prevent clinical disease. So having symptoms, becoming clinically sick, okay, people might still carry the virus in their nose, in their saliva, and spreading it to others who might be less immune, and then might end up getting the disease, and who knows. Okay, so basically we want to make sure we continue to reiterate this message. Now we have a vaccination plan. Dr. Ezike will talk about it. Thank you so much for your time, for your attention.
Assalamu alaikum. This is Irshad. Dr. Kamal, maybe you want to just share a few more pointers. Dr. Ezike is running a few minutes late. She just texted that she's on her way.
Okay.
So please, if you want to continue with a couple more slides for your update.
If we have questions, I don't know. I'm not looking at my chat window. I don't know if we have any questions. So basically, what we know is we have two vaccines that are highly effective, especially against clinical disease, especially against a severe clinical disease. So, however, we are still far from reaching this herd immunity that we are all aspiring to have, to protect, so we can go back to our normal lives. We're still, hopefully within the next several months, things will start easing up, and then we can have some more sense of normalcy. However, as of now, some of us are vaccinated, others are not, and we want to make sure our community gets vaccinated. This is why we work very hard to bring you to the resources. We are working with other organizations. We're Dr. Ezike, the director of the Illinois Department of Public Health, will speak to you directly about the vaccine and the vaccination plan, how our community will be engaged in the process. There are a lot of myths out there, and we need to make sure we distinguish between facts and myths. We need to make sure we do not distribute myths and lies about the vaccine, because we will be spreading dangerous information that might kill people. You know, if the vaccine is protective and we are discouraging people and we discourage people from taking it, we will be responsible for that. So if you are not convinced vaccines help, at least do not spread false information and spread myths that might discourage others from taking it. I have, alhamdulillah, on Monday, I went to UIC and I took my vaccine. I'm still fine. I'm here, I'm speaking, and I did not, just a little bit of soreness, but that's it. That's it. And we should be grateful. At least we are in a place where we can get the vaccine, and others in many parts of the world do not have access to the same resources, to the same care we do. So, and if you have any questions, if you have any concerns, it's okay to have concerns, but you want to ask the right sources and get the right information. So we are not relying on all of these social media and WhatsApp videos that are circulating around that might affect efforts to immunize and protect our community.
Dr. Elderawi, we did have one question as we await Dr. Ezike, and what information could you share about this new technology in terms of potential long-term effects of getting this vaccination? Do you have any information you could share about that concern?
I don't have, basically I have the information that's out there. This is, we do not have reasons to believe this new technology will basically will have long-term detrimental effects. We have the side effects of the vaccines. They are already announced. So we have side effects for the Moderna vaccine. We have soreness, we have swelling, we have redness. You could get chills and tiredness and headache, especially, I heard sometimes after the second dose. The same goes for the Pfizer vaccine. There are some side effects. As far as side effects, any medication we take had side effects. As far as the long-term effects, so far we don't have reasons to believe there will be the long-term effects, the detrimental ones that we are hearing in some of these social media posts. But do we know everything about the vaccine? It's a new vaccine. It's a new vaccine that's being given to people right now. So do we know everything moving forward? We don't know everything moving forward. Do we know how long protection it will give us? We don't know how long protection it will give us. Okay, so but we have scientists who studied the vaccines, and they have assured us it is safe to take the vaccine. There are side effects like any other medicine, any other vaccine we take, but vaccines still protect. Vaccines still save lives. What's the alternative? The alternative is to just stay in this in this situation for how long? And who among us, some will get the disease and many will die. Okay, I see
Dr.
Brother
Kamal,
Rashad raising his.
Dr. Kamal, can I add on to that question?
Yes.
So I'll speak to this as a pharmacist, and my job is primarily to know medicines and vaccines and the science that goes into all of this. I'll speak to specifically the vaccine research. For any drug or vaccine to be approved, to be available, it needs to have intensive research and to be reviewed by the FDA. So a drug company cannot simply just make a vaccine and release it to people. So in the case of both the Pfizer and the Moderna vaccines, they included research studies of 40,000 people each. So to put 40,000 people into context, that's in the entire, that's a little bit smaller than the city of Evanston. So imagine the entire city of Evanston gets included in a research study. Half of the people get vaccine and the other half of the people get placebo. And that's how you can prove that the vaccine was so effective. In our case, alhamdulillah, the vaccine is really effective in the fact that it prevented the spread of COVID and reduced the rate. In the vaccine arm, it was 6 people out of 20,000 people who got COVID. And in the placebo arm, it was 169 people out of 20,000 people. And so that is like, that comparison is so effective that it's really hard to even debate how effective the vaccine is. And I will attest to this as a pharmacist as well. Every single medicine has a side effect. Even the antibiotic that you request from your doctor when you're feeling sick has a side effect. The only thing that makes people feel comfortable about that is those are medicines that they're familiar with that are not quite new. But taking it from professionals that are within the community, we can attest to the fact that both of these vaccines are extremely safe and also extremely effective. There may also come a time where, inshallah, in 2022, we may not need to wear a mask anymore. We can have gatherings again. We can have a full house for a masjid. We can have tarawih. We can have Eid prayer. All of the things that we were accustomed to before, inshallah, we can have those things again. We just need to make sure that everyone's safe and protected.
One additional question that was posed, to the extent that someone recently got a shingles vaccination, what impact, if any, would that have on taking now the COVID-19 vaccination?
I have not, you want to go ahead and answer?
Yeah, absolutely. So you need to wait for a period of 1 to 2 months. I'll need to look it up exactly to know exact duration, but I know it's at least a period of 1 month. The reason is that your body is developing antibodies to the herpes virus from the shingles vaccine. And so it needs a little bit of time to be able to develop antibodies for coronavirus. I believe it's 1 month, but I can look it up and follow up with whomever afterwards and let them know for sure that the exact duration.
Thank you.
So just while we're waiting, again, I want to thank everyone joining it. I see there's a lot of leadership team on this. So just quickly wanted to share, I know we talked about the vaccination, we talked about the rollout. One of the things that I wanted to share, the CIOGC is partnering up with our partners, Advocate Aurora Health, and then coming up with the vaccination plan, especially for in 1A phase. What that is inshallah, the goal is for us to have all the free clinic that are operating in the masajid in the community will be vaccinated through CIOGC and Aurora, Advocate Aurora Health Program. Not only that, but also inshallah, we are working on a team that can also be vaccinated in 1A, which is the funeral and the ghusl team. That 1A will be available for that vaccination plan. So the reason I want to share that, and I see there's a lot of leadership people on the call, so this message CIOGC will be sharing. And if you have a free clinic within your community, and if you have ghusl or funeral services within your community, please reach out to CIOGC. That vaccination plan for 1A has already started, and all we need is your name and contact information, and then inshallah we will pass that along to Advocate Aurora Health Services, our partners in this, and there will be a plan for getting vaccination. So that's for 1A. 1B, as we all know, that's the second phase of it. There will be more talk about it, the timing wise and all that. But inshallah, for 1B, we're also preparing to have these vaccination to all our imams. So this is something is already in works. So we're putting a database for all our imams, and inshallah, that communication will also be sent out So with your community, the imams of your community, and people who are in the leadership role, we're hoping that will be part of the second phase of 1B plan on this vaccination. So stay tuned. A lot more information is coming up. And inshallah, our plan, obviously with the CIOGC COVID-19 Task Force team, to continue serving the needs of our community by educating them through these webinars, making sure we're partnering up with the organization who can leverage this partnership and support us in a way that can help in vaccination plan. And that's what we're working on, inshallah. So 1A is active for those who already have a funeral home and the free clinic in your community. And the phase 1B, inshallah, we're planning for the imam and the masjid staff and the leadership. So more communication will come out, and please make sure that you have this information available and ready for us. And if you already have that information, please send it out to CIOGC. We are populating the database. And once this plan is rolled out for 1B, we will be quickly able to respond to that. So inshallah, if there's any questions, that we will be taking that on as we continue with this webinar today.
And one thing I want to make sure I say, I want to thank all our partners, all our volunteers, community advocates, and community leaders who have contributed to our efforts throughout the year, basically, since the pandemic. Thank you so much. We really appreciate all the hard work you have put into supporting and helping the community.
As we, inshallah, as we continue to wait for Dr. Ezike, I think another point we want to share with you and underscore, as Dr. Elderawi shared, that notwithstanding the vaccination, we still have an important role in preventing the spread of this virus. Now, we must continue to practice the safe distancing, as well as as Dr. Kamal went through the chart, continuing to wash our hands and take those steps to further prevent others contacting it, even though we may have developed an immunity as a result of taking the vaccination. The other thing I would like to share is this is the second seminar or webinar we've provided regarding the vaccinations. We're fortunate to have, inshallah, very soon, Dr. Ngozi Ezike, the director of the Illinois Department of Public Health. Many of you of us are familiar with her. I mean, each day at 2:30, she joins the governor and gives us an update, timely information. And she and her staff have worked tirelessly to make sure we have accurate and timely information that will assist us in preventing being infected, and to guide our social interactions on a daily basis. So inshallah, we expect her to join very soon. With that in mind, if there is Rashad Khan, our chair, has outlined some of the plans that are awaiting us for the rollout, and hopefully the information we will gain this evening shortly will identify other ways that all of us can participate and become effective partners in supporting Illinois. We have now, alhamdulillah, been joined by Dr. Ngozi Ezike, as once again, the director of the Illinois Department of Public Health. And I will now turn the platform back over to Dr. Kamal, our chair of the COVID-19 Joint Task Force, to make a couple of preliminary remarks in introducing Dr. Ezike. Dr. Kamal, you're muted.
So just wanted to take this opportunity. This is Rashad Khan, Dr. Ezike. Welcome. Welcome to this webinar. I know it's a very busy day for you, and it has been every busy day since the start of this pandemic. And on behalf, this is the chair for Council of Islamic Organization of Greater Chicago. On behalf of entire community, I want to extend my gratitude to you and your team for your tireless effort that you have started from the day the pandemic has started. And I know you and your team is doing an amazing job. We want to congratulate you on behalf of the entire community of Illinois. And we want to thank you for your efforts that you have made to make our communities across the Illinois safe and healthy. So thank you and welcome, Dr. Ezike.
Dr. Kamal?
Yeah, I would like to welcome Dr. Ezike, a board certified internist and a pediatrician who joined the Illinois Department of Public Health from Cook County Health, where she had served for more than 15 years promoting the organization's mission. Dr. Ezike has been working tirelessly since the start of this pandemic to help lead and guide our communities in the state of Illinois to protect our communities. She is a Harvard graduate. We are so delighted. We are so honored and humbled to have been joined by Dr. Ezike this evening. I want to take this opportunity to just briefly highlight some of what we have done as the CIOGC COVID-19 Task Force of over 100 community leaders, advocates, and organizations. The task force was launched as early as March 12th to address the needs of the community, and our goal is to educate and guide the community and facilitate access to needed care, support, supplies, and resources. Since March, let me share with you some of the things we have been able to accomplish. Since March, we have engaged 150 mosques and service organizations, spending over $300,000 on programs and impacting around 400,000 Muslims in the state, directly or indirectly. We have established a hotline for health and mental care, COVID-related questions, and other relief services. We have distributed 1,200,000 PPE as well as face shields and hand sanitizers to health professionals, first responders, and member organizations. We have conducted 20 educational webinars and produced educational videos and distributed around 100 COVID-19 informational banners to mosques and organizations. We held numerous meetings with community leaders and developed guidelines for mosques and schools in the community on when to close and how to reopen safely while adhering to local and national guidelines. And working with other partners, we have coordinated the distribution of over 10,000 food boxes, financial support, housing support, and other services to hundreds of people around the area. We're very delighted to have Dr. Ezike with us this evening, sharing with our community the vaccination plan and how we can engage with the IDPH to protect and support our community. Please join me in welcoming Dr. Ezike.
Thank you so much for that warm welcome and introduction and the beautiful review of the great work that your organization is doing. Again, please accept my apologies for being late. As you have said, it's been such a long and difficult year, and I tried as one of the New Year's resolutions to have a time that I leave and start heading home. So I fully intended to be home so that I can see my kids before they sleep. And I got a little bit stuck and was late. So thank you. I'm begging for your forgiveness for my tardiness, but I'm so excited to be with you. And again, in this COVID response, we have so many partners. We have partners like you who are doing so much of the work that is parallel to the work that we're doing. We are trying to educate people. You are actively educating people. We are trying to make sure that everybody has the necessary PPE. You are passing out that PPE. You are feeding people who have been hurt by this pandemic and don't have food. So I am so grateful for all that you're doing. We wouldn't be where we are. And you know, Illinois is in a good state compared to many others. And it's because we have so many different stakeholders and partners doing their part, doing their share. I'd like to report where we are so far. You know, what I remember talking to legislators in May of, when would that have been? No, it would have been the veto session in about, what is that, December of 2019. Everything is a blur now. And I remember talking about vaccines. We were talking more about vaccines related to measles because in 2019, we had a resurgence of measles because so many people have turned away from vaccines and say, oh, it does this and it does that. And we had multiple cases of measles. And, you know, we had the big outbreak in New York. And so I remember talking to legislators about the importance of measles. And then when I came back to them a few months later, we had started having our first cases of COVID. And so that was like February, March, people are saying, oh, this COVID, how about a vaccine? What about a vaccine for COVID? And so we're like, yes, you know, hopefully, you know, we'll get a vaccine because this disease is awful. Well, fast forward just 9-10 months, we actually have a vaccine. And so this is tremendous news. This is the news that we were waiting for when we first heard about this deadly virus that, you know, really did a number in Wuhan, China, spread throughout, you know, all over the world. And so the fact that we have this vaccine, that's something we should be celebrating. And we have in Illinois already given out to the people in Illinois over 500,000 doses of vaccine. You know, it's going up every day. It should be 530 maybe is the last count. And every week we get more shipments of vaccine from the government, but it's small. It's so small. So, you know, we are working very closely with the CDC. They came up with these guidelines that said, you know, initially we might not have a lot of vaccine, so we're going to help you prioritize. We know that our nursing homes were devastated in the first wave. In the spring, like 60% of all the deaths were from the long-term care facilities. And so keeping that in mind, that was identified as the first group that we have to get our long-term care facilities because of both their age and living in a crowded congregate setting, they were at risk. Once you get one case in there, it was just horrible. And then we had to protect our healthcare workers because if you need help in the hospital because you have COVID or you have a cardiac condition, whatever it is, you need healthy medical people working in the hospital. You need the people who clean the rooms. You need the people who prepare the food in the hospital. You need them there, or else you go to the hospital and there's nobody there to take care of you. So that was the thinking behind the 1A, which was established as the first group that was going to get the vaccine. So we think we've gotten maybe many of those people in that group. Unfortunately, more people than we anticipated said, no, I'm scared. I don't want to be first. I don't want to get it. So a lot of people that we thought we would be giving it to, we didn't. So we're continuing to work with those people and educate them. You know, some people are like, well, I didn't want to be first. Now I see that my coworkers haven't lost any limbs. They're still alive. Okay, maybe I want to get it now. So there's been some slow uptake of the vaccine as people who were initially scared have seen other people take it and say, okay, maybe I can take it. In this country, the whole country, we have done over 15.5 million. So we know that people get it safely without severe consequence. We have had some cases of the anaphylaxis. So, but we are now transitioning. We still want to finish 1A, but we're also transitioning officially on Monday. We will move to the 1B, and the 1B group are the people over the age of 65. We decided to make it 65, as well as some of our frontline essential workers, our police, our firemen, We've put the educational sector, K through 12, those educational people. We have the people who drive the buses. People who drive a bus are coming in contact with so many people every single day. They cannot work from home as a bus driver. So, all those some of those essential workers are also prioritized. But what I want to explain and why we need so much patience and we need the leaders to be able to take this message back is that between the healthcare workers and the long-term care residents, the long-term care staff, and then the people over 65, and then those frontline essential workers, that's 4 million people, okay? 4 million people, our state is like 12.7 million, and we are getting 120,000 doses per week. So anyone can help me do the math and see we're just getting a trickle of what we need. So 4 million people can say, it's my turn, but I've got this week only 120,000. So you understand the dilemma. So when people call and say, well, what about this group? This group is very important to get the vaccine. This group is very important to get vaccine. These people are also high risk. I agree. And if we had, 12.7 million doses, we would just give it out to as many providers, as many hospitals, as many urgent care centers, as many FQHCs, and just say, give it to everybody. But when we have such a limited dose, we're really struggling. And so I know nobody's going to be happy. We don't have the ability to vaccinate everybody who needs it. We'd love to do all the teachers and make sure school is safe. We'd love to do all the bus drivers. We'd love to do all the people over 65. We'd love to do the people who have diabetes, hypertension, kidney problems, but it's just not there. The resource is not there. And we have a giant state and we're trying to spread it equitably across the entire state. So it means that each of these counties, our 102 counties, each get like, here's 100 for you, here's 200 for you. It's really just a trickle in all of these places. And so they do the few that they have, and then they're waiting next week. Where's the next one? We're hoping that the production will be increased by the manufacturer so that there may be more, that we can get more than this. We also hope that maybe the AstraZeneca, the J&J product, that they will submit their applications to the Food and Drug Administration and receive that authorization, and then we'll have the availability of those vaccines, because those have already been manufactured but are waiting to see if they will meet approved authorization. So hopefully there will be some other vaccines that get authorization that will increase the pool of vaccines so that more people can get vaccinated faster. So I don't have a solution to the problem of all these people that should get their vaccine that we just can't do. And I hope that you will help me in getting that message out, that yes, you deserve the vaccine. You need it. We all need it, but there's just not enough. So we will just keep putting it out, the trickle by trickle, as we get it every week. We are putting it in pharmacies around the state to have them help us get that to people. But again, they will even be getting a small amount because it's still the same allocation from the 120,000 that we have to now divide and include all the pharmacies as well. So please, we're just asking for some understanding around that. But if there's issues in the community that we need to address in terms of hesitant people, I want to get at that so that we can give the appropriate information so that when it is your turn and when you do have the opportunity, that you're not still saying, wait a minute, I'm not sure. So let's get everybody sure and waiting. And then when they get that opportunity, they will, willingly pull up their sleeve and get this important vaccination. We think that we need more than 80% of the people to get vaccinated before we can feel secure as a community that, we can help quell the infection transmission. But now with this new UK variant, every day, we're finding some UK variant here in the state, which of course, if it's in other states, it's going to be in Illinois too. So that will actually mean that more people have to be vaccinated to get the herd immunity, because we are hearing that it's so much more transmissible. So it's not the time to, put away the mask. In fact, I'm usually wearing 2 masks now because I want to make sure that if I encounter the UK variant, that, I have extra protection since it's so much more easily spread. But so we're fighting that, but we are also pushing the vaccines as quickly as we can get it. I heard our new president today said he's issuing a 100-day mask challenge, that he wants everybody in the United States to wear their mask 100% for the next 100 days. And we know that that in itself will considerably lower the spread of this disease, because in this country we're noting over 4,000 people every day dying. In Illinois alone, it's over 100 people that are reported to us every day that are dying. So please let me know how I can further support your great efforts. Let me know what questions you have. I'll stop there to open it to you to share any feedback, concerns, ideas, questions that you may have.
Dr. Ezike, thank you for those remarks. They're well received and encourage that we now have a vaccine that can begin to address our concerns. But before asking more specific questions, would you outline how our community can be engaged in your vaccination rollout plan?
Yeah, it sounds like you're already doing it, probably getting the word out. I think informing people, I don't know what the issues are, if there's a lot of hesitancy in the community. If there are, we want you to get the information as the leaders and then make sure you're giving accurate information. I've seen people forward me this information where it's a video of somebody supposedly getting a vaccine, and while you're watching the person get injected, then their face is turning into an animal, and people are like, see, this is why I don't want to get it. And so there's a lot of information out there that's really not accurate. We need to make sure we direct people to good sources of information, the cdc.gov website, of course, the IDPH website. We want people to have the true information. I also would love for your members to agree to be community ambassadors with IDPH. We are trying to recruit as many people that have, some social media. Either they have Facebook accounts, or they tweet, or they Insta, or they, whatever those platforms are. Our representative who's leading the community ambassador program will send you infographics, will send you emails, will send you links that you can put on your social media so that you can help engage, your social network in the discussion around vaccines and COVID generally, so that we can spark that dialogue and get people thinking, and remind people about masks, and remind them, even if you get the vaccine, you still have to mask. Tell people about the treatments that are available. We have remdesivir, we have the monoclonal antibodies. We want to make sure that everybody in your community has all of this information.
One concern among our leaders in our community is, when we look at your the phase program, particularly like we say, when we look at the 1B population, we have significant numbers in our community that are in this priority population, but they're not usually access to them is not through traditional means. Many are undocumented. There are others that just have a fear of government itself. How is the Department of Public Health intending to reach out to this? And more importantly, how can you engage with us to assist in that effort?
Yeah, so that's going to be for you to let us know where these communities are that may not be using the traditional channels, that where Walgreens might not be a good option. Each community needs to work with their local health department. There's 97 different health departments, from the Cook County to the Chicago to the Evanston to all the ones, in central and southern Illinois. We need to make sure that you're communicating directly with the health departments that represent you, and that they know where these, quote, harder to reach communities are, so that they can be intentional, whether they have to send a strike team to go into an area, or if they have to have a special vaccination pod for a hard to reach group. It's going to need just a communication where the people that maybe are not getting the message, and then you identify them and highlight them to the health department.
That would be on the local, you're saying, like for in the city of Chicago, etc. Okay,
Correct.
you know, I'd like to turn the platform over to one of our leaders, Ishaq Lack, who is a pharmacist himself and has played a key role in the vaccination program to date. Ishaq, could you step forward and answer your question, please? Unmute.
Good evening, Dr. Ezike. Thank you for your time. Greetings of peace from the Muslim community here in Chicagoland area. I know that it's been a busy day for you, and with young kids myself, I can only imagine what your day is like getting home this evening. We had a question with regards to our role as community members. We have a high level of trust and engagement with our community members that are harder to reach within the community. These are people who may be hesitant or have expressed concerns about the vaccine, have lower healthcare literacy. And so is there a role for faith-based organizations and community partnerships with IDPH to be able to reach these people and perhaps offer ourselves up as a vaccination site and vaccination partners?
Yeah, no, definitely. You know, as I mentioned, I think right now we don't have a lot of vaccine. So, but, you know, one of the things that I had tasked my communications team to do is that we need to schedule an event. And I told them it should happen, you know, I wanted it to be this month, maybe it'll be February, where we have an event where we have someone from, you know, the Muslim community, have somebody from the different faith communities, different ethnic communities, have us all be there, maybe getting vaccinated publicly, showing the confidence in the vaccine to represent the different communities that make this rich community that we have. And hopefully that's one of the steps that will show people, look, you know, people that, you know, represent me, that look like me, that think like me, are also involved in thinking that this is a good move. And so I'm more encouraged. We've done lots of surveys to see that people, you know, from their community, people that look like themselves, helps engender trust. And so we want to be able to do that with your community as well.
The next question will come from, we have many medical professionals in our community. It's a blessing. And one of them is in public health. Her name is Hiba Abbas. Hiba, would you ask your question of the director?
Hi, Dr. Ezike. Good evening. Thank you again for taking part in the webinar. So my question is, as Brother Mitchell stated, we have a lot of medical professionals within our community, doctors, nurses, pharmacists, who are ready to stand up and assist with volunteering to administer vaccinations, along with community Muslim associations like CMMA, PPS, or medical organizations who are wanting to help volunteer. How can we engage with these professionals, and what opportunities are there for us in these organizations to assist with vaccinations?
Thank you so much. We love to hear that question. We absolutely need vaccinators. There is a IllinoisHelps.net. So the full state, Illinois helps with an S.net. That is the platform which you can go to and say that you want to be a volunteer. I think it allows you to choose who you would like to help. So you can select maybe the closest local public health department, and that will go to that local health department. And then that public health department will understand that you are someone that when they need additional vaccinators, that they can reach out, that, you know, they will be connected from that portal. So please, IllinoisHelps.net. And select your local health department. There's many other organizations that are listed there that ask for help because it's used for other things outside of COVID. But in terms of being able to help with the vaccination effort, if you select your local health department, that local health department will be happy to get the name for when they have a vaccination effort and need more people to put the needle in the arm.
Dr. Ezike, let you know, in addition to HIPAA, there's you got more public health officials or workers with you. And then the next person to ask the questions is Javaria Ali. Javaria, would you ask your question, please?
Yep. Thank you again, Dr. Ezike. What are the requirements for the establishment of a mobile vaccination unit?
So if is it like if it's a one-time event where someone is trying to maybe reach a hard to reach community, it's usually that the local health department will work with the group that wants to do this mobile event. It would be planned, how many people are you planning to reach? And then they would make that specific amount of vaccine available for the event. So it can be coordinated through the local health department. Most of the, a lot of the vaccine is given, allocated to the local health department, who then identifies partners in the community with whom to share it with. So again, a lot of, the state, has the vaccine, but we use our arms and legs are the local health departments. And so we push things through the local health department, and then they know their community best and work with their community to get it where to the, the corners of the community that need it.
Dr. Ezike, I have one question I would like to pose to you. In the introductory remarks made by Dr. Elderawi, it showed some of the things that we have done since the start of the pandemic. I mean, we've got frontline workers out there, passing out food. There's health consultations, even dental care was provided. And particularly it's acute when we look at our agencies that provide social services to at-risk companies. I mean, they're the ones that are helping them get food, get the help with their utility bills. I mean, we have several organizations. I rattle off names of Syrian Community Network, the Muslim Women's Resource Center, as well as Arab American Family Services, just three that I call off the top of my head. Our concern is this: as we review the plan, we don't see how they're segmented in there, and yet we see they're in this high risk based on their profession, what they're doing. Where are they located? I understand the remarks you made earlier, where there is a limited supply, but we just need to understand, and we're advocating for them to be put into that 1B group. But where are they at? Those kinds of workers, social service workers who are delivering that kind of help to those people who are actually in need and at this time.
Yeah, so we do have a 1C group that has not been officially announced. And so some of the people that you're talking about would likely be in there. I don't want to get too far ahead of myself because the governor hasn't made the official announcement, but there is a 1C group where people who are forward facing, working with the public directly, where many of those people will fall there. But again, we're still it's going to take a little bit of time to get through the 1B unless the vaccine allocation increases significantly. So, but there is the 1C that follows.
Thank you. The next question it will be given by Dr. Kamal Elderawi. Dr. Kamal, you're muted.
Yeah,
limitations of technology.
Again, Dr. Ezike, I want to thank you so much for joining us. As you have said, and there's some hesitancy in some communities, and research has shown there is hesitancy in the community. Are you allocating resources and support to faith-based organizations, to community-based organizations, to address this hesitancy? For example, producing culturally sensitive, culturally appropriate educational materials, communication tools, messaging, through social media and other platforms. Are you providing any kind of support and resources to these community organizations? And how can we, as CIOGC COVID-19 Task Force, we have already worked with over 100 volunteers and organizations to really address the needs of the community around COVID-19. Are there any resources? How can we work together moving forward to address this hesitancy and make sure our community is vaccinated effectively, efficiently, and equitably.
Yeah, no, thank you for that, sir. So, we have reached out to the Muslim, the Greater, I think it's the Greater Islamic Center in Springfield. We have had like something similar to this, a virtual town hall with I think the Islamic group of the Greater Rockford area. So we're trying to reach out to different groups in different parts of the state. But I think I need you to tell us, what modifications we need to make to some of our existing information. So, if you can give us a volunteer from your organization that can work with our communications team, to tell us how we need to better tailor the existing documents that we have to make it more culturally appropriate. We need that support to make sure that we are delivering a product that will be well received by the community.
Thank you.
Probably one last question before I will bring on our chair to offer his closing remarks. But the one question I've received a number of times is does it make a difference which vaccine that they take? I guess that once again, where you start talking about the information, all the disinformation that surrounds the vaccines, is there anything you could share, at least to alleviate those concerns of some of the members of our community?
Yeah, so it's a good thing. I think it's a good thing because it helps quell some of that both of the vaccines that are out use a similar platform, the mRNA platform. They both have similar efficacy in terms of 94-95%. They both require 2 doses. So there's no appreciable difference. I saw the Surgeon General get the Pfizer vaccine. I saw Dr. Fauci get the Moderna vaccine. So, I think we're good with both of them for sure. I think it might get a little interesting when some of these other vaccines come out where they say, oh, you only need 1 dose. You might have people say, oh, I want that one instead of this one. But then the efficacy for that one, so far, it's not official yet, but I think some of the reports said is 80%. So 80% 1 shot, 95% 2, so I don't think, I think any vaccine you can get, you better get it.
All right, thank you for those remarks. And at this time, I would turn the platform over to our chair, Irshad Khan, Brother Irshad.
Sure. Thank you, Brother Mitchell. And again, I want to thank you, Dr. Ezike, for taking time to be with us today. We just wanted to give you some of the background of what we as an organization, which represent the Muslim community of Chicagoland area. We have 62 plus organization as a member, schools and relief organization. And we have been serving the community needs for past 29 years. And what we wanted to offer you is our support and the collaboration that is required. We know it's a monumental task for a government to take something on without having the community partnership to leverage this and enhance the work that you guys are doing. And again, I mean, I've been watching you at 2:30 or 3 o'clock press conferences. You're always there with Governor Pritzker and serving and making our community safe and healthier. So I want to extend that arm of our collaboration to you, and I want to offer you. We have health professionals, as you heard. We have been serving our community, especially since pandemic happened. There's so many efforts that we have made. We actually took step by step with Governor Restore Illinois plan, and we perfected that plan in terms of the guidelines and shared that guidelines to our community. So that is what an umbrella organization like us offer to our community, because they're looking up for the voice and they're looking up for our support. And that's what we want to end today with, is to offer you that same support that we can bring you in our community, share the concerns of our community, leverage the plan that you have, and enhance the plan that you have and support this vaccination plan. I know there's a limitation of the vaccination. I know that you and your team are tirelessly working to enhance these efforts going into the vaccination plan, and we are step by step with you in this. So please reach out to us, let us know where and how we can help you. And we actually are looking forward to get this vaccination plan enrolled. I know we have partnership with Aurora, Advocate Aurora Health right now, and they are offering us the vaccination for our free clinics that we have around the mosque and our community centers. So we are putting their names on this 1A, and we are hoping that 1B offers us the plan that can vaccinate all our imams who are representing our community and leading the congregation of the prayers. So we want to add them to this 1B plan with the support of you and our partners. So we're here to support you. Reach out to us, let us know. There are a lot of questions I'm seeing in the panel here that have been asked. We would like to have another opportunity with you to sit down and go through some of those questions and have a smaller group setting, and then see how we can better enhance our efforts, us as a community and community leaders, and then you offering that support. I see that, we have like more than 45 or more leaders who represent more than 1,000 to 2,000 people in their community are here on the call today. Especially, I want to call out to some of those. Talat Usman, he's one of our founder. He has been working with CIOGC for 29 years. He's on the call. So these are the leadership people who are on this call, and we appreciate them joining us and listening to Dr. Ezike. So with that, I want to turn it over to you, Dr. Ezike, for your closing comments.
Thank you for those comments. That's music to my ears. And first, I don't think I got a chance to thank my friend and colleague from IDPH, Dr. Mohammed Nasir. He is doing such an important job running the lab in Chicago, making sure everything is going well. So Dr. Nasir, thank you for this opportunity, and thank you for linking me to your esteemed organization that's doing so much great work. We do have on the line Juana Ballesteros, and so she really coordinates all of this community outreach. So she has heard what you said and that offer to help and to serve, and she will absolutely follow up. We need to hear from you. We need your leaders to be sharing our message. And so she will connect very intensely. And now that you've put that call out, you're not going to be able to get rid of us. So we will absolutely be calling on you. We will be getting all the information that's necessary so that we can be culturally appropriate, culturally sensitive, and not leave anyone behind. So Juana Ballesteros, she will absolutely follow up, make sure that many of you become official community ambassadors, and that you are pushing out the messages, and that you in fact are helping us create the appropriate messaging for your community. So I'm so excited to form this bond. And one of the good things about COVID, I mean, so many bad, but there are good things. It's caused so much partnership and collaboration. This is one of the great examples. And so even when COVID is over, when we fight and put COVID in the rearview mirror, we'll continue the collaboration so we can tackle other important issues that still need us to continue working together. So this is the beginning and of a long and prosperous relationship. So thank you for that.
Thank you. Brother Mitchell?
Yep. Yes, and once again, I get echo what you've heard numerous times today, and not only to you, but your staff. We do sincerely appreciate the tireless effort you and your staff have put to keep us informed and how we can best protect our family. And with those remarks, we will thank you once again for your team joining us this evening to educate our community. We thank all our community leaders and members who have joined us this evening. And we will upload this webinar that you can continue to share. So Dr. Ezike's message will continue to resonate throughout our community. And for each of us, have a blessed evening. Assalamu alaikum. Peace be upon all of you. Thank you.
Thank you. Good night, everyone.
Good night.
Thank you. Good night.